The latest news, updates, and more from the world of health and medicine. This is Medical Minutes, brought to you by Community Health Network.
Oh, the sphygmomanometer, the blood pressure cuff. Blood pressure is the reason for this morning's checkup. Wish TV medical expert Dr. Janelle Gordon is here with the realities and the ways to keep your BP in a healthy range. This is extremely common, isn't it?
Very common. It's actually the #1 preventable risk factor for cardiovascular disease and the #1 cause of death globally.
The key word in that, though, is preventable. So let's dig into it, try to help people help themselves be a little healthier. What's a normal blood pressure range?
So we've thrown the numbers back and forth, I would say, over the last 20 years. But now what we're really saying is that on the top, your systolic blood pressure should be anywhere between 90 to 120. And on the bottom, your diastolic blood pressure should be between 40 and 79.
So even people say 120 over 80, that by definition, that 80 is just a little higher than we'd want it to be.
Just a little higher. So actually, once you bump up above 120 over the top, on the top, or above 80 on the bottom, then we consider that to be pre-high blood pressure or stage 1 high blood pressure.
Show of hands. Anyway, we'll get to that later. What do you want prospective moms especially to know about the dangers of blood pressure?
Yes, so it's very important for those individuals with high blood pressure who are not just pregnant, but even those considering pregnancy, have a thorough discussion with their healthcare team about starting a low-dose aspirin, 81 milligrams, in the late first trimester and continuing that until delivery to decrease the risk of preeclampsia.
Let's talk about preeclampsia. Warning signs of it?
Yes, preeclampsia is very severe. So oftentimes they'll have blood pressure 140 over 90 or higher. They'll start having swelling in their face, hands, and feet. And you can see how this can be confusing because some of these symptoms may happen in pregnancy, such as increased urination, fatigue, vision changes, and difficulty breathing. If a mom is experiencing any of these symptoms, abdominal pain, increased weight gain, again, commonly occurs in pregnancy, they really need to speak with their healthcare team and be evaluated emergently. And we really want to make sure that healthcare professionals have a keen sense of these symptoms so that we're not missing it in individuals. And pregnant persons or those considering it should be aware that preeclampsia doesn't stop at delivery. So individuals with high blood pressure are at risk for developing it even within that first year postpartum.
Snapping back to bad habits just because the baby's arrived doesn't necessarily mean that you've gone past the danger zone.
Exactly.
All right, let's broaden this back out to kind of everybody. There are new guidelines about blood pressure?
Yes, new guidelines. And so what we know is that there's a lot of talk about dementia, Alzheimer's, memory changes. We know that when there's increased blood pressure, there's actually pressure on those small blood vessels in the brain, leading to difficulty with memory, decreased cognition, and increased risk of dementia. So now there's increased effort for us to seriously control blood pressure in individuals. So again, we want to make sure everyone knows what the normal blood pressure is. And then think about lifestyle changes early on that you can do to hopefully decrease your risk of developing it or complications of it.
Is this one of those where your numbers are low, often when you're younger, and you think, I'm not worried about that then? And then if you develop habits, then you may head it off forever? Or is it best to only worry about it once the numbers are too high?
I see this all the time. So we really want to make sure those with the family history are paying attention. And just because it runs in the family doesn't mean you'll have it. You do have power to change your destiny with lifestyle changes. Anyone who they go into the doc and they say, oh, I have white coat hypertension, we want to make sure that you're doing outpatient monitoring to see what is it when you're in a more relaxed setting. If it's still creeping up, then we really want to pay attention to it. Watch your salt intake. So I'm constantly asking individuals to make sure they don't go above 1,500. And they'll say, oh, doc, I let go of that table salt years ago when you changed recommendations.
Yeah, but how about that bag of chips, though?
Exactly. And make sure you're working on stress reduction, such as meditation or yoga, and seeing us regularly. There will be more information in my article at wishtv.com.
Perfect. We'll read up on that. You mentioned preventable. That's the key to everything. Thanks for the morning checkup.
Yes, thank you.
Dr. Janelle Gordon.
This is Medical Minutes, brought to you by Community Health Network.
Learn more and get more with Wish TV.
Online at wishtv.com, and when you follow Wish TV on Facebook, be sure to check out more great podcasts from the All Indiana Podcast Network now.
Now at allindianapodcastnetwork.com.